A surgical specialist is ultimately responsible for every decision inside the operating theater. Becoming an independent surgeon requires assuming total liability for a patient's life. In India, the National Board of Examinations designs this transition through the DNB General Surgery program. They execute this transformation within a non-negotiable 36-month window. The curriculum relies on 3 locking pillars: clinical exposure, academic research, and continuous evaluation. These pillars are interdependent. A trainee cannot offset a lack of clinical skill with high academic scores. Failing to meet the standards in any one area halts the entire program. The required end state is total competence, covering everything from basic ward management to complex multi-system trauma. These 36 months function as an engineered blueprint, mandating that surgeons prove proficiency through specific, documented milestones at every stage of their training. The first pillar is the clinical foundation, building a trainee's technical capacity through a hierarchical skills matrix. Progression starts at the pyramid's base. Trainees master essential ward and ICU procedures, like intravenous access. The middle tier adds emergency and minor surgeries, like appendectomies, under supervision. The apex is reserved for major operative procedures, including complex interventions like bowel resections. Because a general surgeon must handle diverse emergencies, the NBE requires competence across multiple bodily systems. This wheel illustrates the mandatory subspecialty rotations. Every trainee must complete at least 15 days each in cardiothoracic surgery, orthopedics, and neurosurgery. To maintain these standards, the NBE categorizes every procedure in the syllabus as either essential or desirable. Essential skills must be performed or assisted independently to pass. Desirable procedures provide exposure to advanced specialties. This clinical matrix ensures that surgeons become adaptable generalists, capable of stabilizing a patient regardless of which system is failing. Technical skill is limited if a surgeon cannot independently evaluate new medical data. This requirement forms the second pillar, the academic engine. This timeline shows the immediate pressure of the research requirement. Within the first 90 days, a trainee must submit a formal thesis protocol. This protocol is a complete study plan, documenting the research question, methodology, and expected synopsis. No data collection can legally begin until the trainee secures approval from the Institutional Ethics Committee. The 2-year execution phase is strictly governed. The final thesis must follow NBE formatting rules and cannot exceed 80 pages. The timeline ends with a hard cutoff. Final submission is required by June 30th or December 31st to remain eligible for exams. Missing this deadline results in automatic disqualification from the final examination cycle. The thesis serves as a gatekeeper, ensuring a trainee's analytical competence is verified before they are permitted to qualify. The third pillar, workplace-based evaluation, ensures that weaknesses are identified and corrected long before the final exam. The primary tool for this is the Formative Assessment Test, or FAT. It provides the NBE with a real-time record of a trainee's progress. This diagram shows the cycle. It integrates a theory examination with immediate feedback sessions and clinical assessments at the workplace. Supporting this loop is the logbook, which functions as the official physical ledger of every case a trainee handles over 3 years. The logbook tracks specific data: case histories, the exact surgeries performed, and the trainee's participation in academic seminars. This record only becomes valid when certified by the supervising teacher and the head of the institution. This evaluation loop and the certified logbook create a continuous record of competence, ensuring no trainee can reach the final stage without a documented history of daily performance. The culmination of these 36 months is the DNB final examination, the ultimate filter for qualification. The examination is split into 2 distinct stages, beginning with the theory filter. Stage 1 consists of 4 rigorous papers, each worth 100 marks. They cover everything from basic anatomy and physiology to the most recent subspecialty advances. Candidates must achieve a 50% aggregate score across all 4 papers to unlock the practical examination. Stage 2 is the practical and viva examination, where the candidate's theoretical knowledge is tested against live clinical scenarios. This practical stage is worth 300 marks and independently requires a 50% pass rate. The NBE allows a maximum of 3 attempts to pass this final practical stage. If a candidate fails all 3, they are removed from the framework entirely. This triad of clinical exposure, original research, and high-stakes evaluation exists to verify a single outcome. The NBE framework ensures that anyone who earns the DNB title is a definitively competent surgeon, ready to operate independently and safely.